Okay.
Hi there. This is State Representative Sydney Jordan representing 60A, which is Northeast Minneapolis and Southeast Como. And I have with me today a frontline worker in Minnesota who is caring for us. I'm really excited to learn more about what she's working on and what that means for everyone in the state. So Faith, do you want to introduce yourself and tell us about who you are and what you do?
Sure. I am Faith Lass, and I'm a special education assistant, or an SEA, at a small community elementary school in South Minneapolis. Normally I work with K-2, it's kindergarten through second grade.
Great. And so we've all heard reports about, most students are distance learning, but we still actually do have children in schools, and you're working with them. Can you tell us what you're doing now during the coronavirus outbreak?
Yeah, I started working for the emergency child care the first day it was provided, which I believe was March 17th. And the first couple of weeks looked probably a lot more like daycare, where we're just kind of like keeping the kids busy and doing enrichment activities and things like that. But once distance learning started on April 6th, that pretty dramatically changed what our jobs looked like at the emergency child care centers. So I've been working for the last 2.5 weeks or so. I've been in a pre-K kindergarten room, and working with the other staff in that room to plan enrichment and academics for the pre-Ks and kind of help support distance learning for the kindergartners.
That's great. And what made you volunteer? You didn't have to volunteer to be in the schoolroom. So what made you decide that you wanted to be someone who was caring for these children?
Right. I think for a lot of us, it was kind of galvanizing when we kind of realized the gravity of the situation. And I just felt like I wanted to help in any way I could. A lot of people need help in a lot of ways right now. And I'm relatively young and healthy and don't have any underlying conditions or anything like that. So that's kind of what informed my initial decision to help out. So I don't have a reason not to. All my needs are being met right now. I have the time and energy and mental resources to go in and help. I don't have kids to look after or anything like that. So just wanted to help support that effort.
Well, thank you. It's really important. It's how we can make sure our other frontline workers are getting to work, and having you there to help your kids learn is really important for our state. So thank you so much. What would help you do your job? What are some things that would make it easier for you to take care of kids or complete your work? What are some things that you'd like to see more of?
Right. I think one thing that would be helpful is reliable access to whatever PPE would help make our job safer. And with that, really clear and specific requirements and guidelines around that would be really helpful for staff and students, ideally. Because right now it's recommended that we wear masks, but we're not required to. So only some people do. Most people don't, though. And I think a lot of that has to do with just the setting, working with really little kids. We're working with kids 4 years old to 11. And especially for the really little ones, communication is a lot more of a challenge than it might be for working with the older students. And I feel like the more that is obstructed, kind of the more challenging it can be.
Right.
And also there's the issue of not wanting to scare the kids, especially the really little ones. But that doesn't mean that we shouldn't do whatever we need to do to make sure we mitigate as much as possible the risk that we're all taking, staff and students. So I think that would be really helpful, just reliable access to those things. without taking away anything from healthcare workers and other frontline workers who also need access to those critical materials. And I think compensation has been kind of a big topic of conversation right now. Right now, the ESPs, or education support professionals, is an umbrella term for a lot of different positions. So there are people at our facility that are childcare assistants, which are some of the lowest paid ESPs at about $15 an hour starting. PAs, which is what I do, and we're about like $17.33 an hour starting. And then there are AEs. There's all these different positions that all normally do different work and are paid accordingly, but who are now all doing the same job.
Right.
And not only are we all doing the same job, but the level of responsibility has dramatically increased, and the level of risk has dramatically increased. So it's great that we have hazard pay. I know a lot of workers right now, for those of us in the community who still have jobs, a lot of workers don't have that. But at the same time, there's a huge disparity between what childcare assistants and associate educators are making doing this critical work, who are now all doing the same job. So compensation that reflects that just
would go a long way.
It would go a long way, yeah.
Right. So one of the ways the state can help is through fully funding public education. I think that making historic investments in education is something that's always been important to the Minnesota House Democrats, and continuing to prioritize our workers and our schools is something that's going to be important going forward. Another proposal we've been talking about is making sure that all districts are keeping our hourly school workers. That would include our ESPs, but also our bus drivers or nutrition staff. What would that mean for you and some of your coworkers who maybe aren't able to join you because of an underlying health condition or because they have to care for their own children?
Right. Providing those folks with the peace of mind and security, and knowing that even if they can't physically be present to help on site, they'll still get the income flow that they need to meet their basic needs. I think, again, just can't be overstated, the importance of that. And protecting like workers across the state too, because it's great that Minneapolis Public has committed to paying us through the school year. That was kind of hanging in the air for a while at first, but may not necessarily be the case at other districts in the state and at charter schools, where folks are either required to report to work and won't get paid if they don't, or don't have that security of knowing that they can rely on their income flow to keep coming through this unprecedented crisis.
Yeah. Is there anything you would like the Minnesota Legislature to know about your work in schools, or work that is happening, or anything you'd like them to know about what the kids are going through right now?
Yeah, I think it's hard to probably make policy when you haven't actually been there and you haven't really like seen kind of what it's like, or even if you're not in a position to make policy change happen and you're just an ESP or a teacher or admin or something who have been working from home, it's probably hard to understand what it's been like. But I think, as in countless industries, it's really shined a light on the kind of gaps in our system. And also, as in countless other industries, it's the lowest paid employees who have been asked to take the greatest risks. So I think that really needs to be honored and reflected in policy. But I mean, as our understanding of the virus evolves, I think, at least for me, it's kind of started to become clear, like the level of risk, and that, you know, we keep showing up every day to try to provide these kids with some sense of normalcy in this really bizarre situation, and to a certain extent ourselves with a sense of normalcy.
Yeah.
Like, frankly, just going into work every day physically and being there and dealing with the, you know, little fires and dramas throughout the day, and all the other lovely things that come with working with little kids.
Right.
But, you know, we've been fielding a lot of tough issues with these kids too, and I think it's important to recognize how much they have been affected by everything that's going on, and how difficult it probably is for them to really understand everything.
Right.
And that puts us in a precarious position trying to kind of deal with those kinds of things as they come, and the behaviors that maybe come with them.
Right.
And answering hard questions, like on my second or third day, a 4-year-old asked me, who I had just met, asked me what COVID-19 was. And I had to try to figure out in the moment while she was coloring how to describe to a 4-year-old what it was.
Right. What a global pandemic is for a 4-year-old.
Yeah. Like,
right.
Those are the kinds of questions we're fielding at work, and the kind of, it's what's kind of always in the back of our minds. And it's hard to really describe, I think, or like qualify what that feels like.
It has to be incredibly hard to not only be trying to, you know, care for yourself, care for your family, but to also be in a position to care for the children of other people who are also putting themselves on the line to care for all of Minnesota. So I think that's incredible that you stepped up to do that. And I think it's important that the Minnesota Legislature cares for you and puts policies in place to protect our school workers, but making sure that everyone in Minnesota has the economic security to care for themselves as well. So that's something that we're really committed to doing. And we owe it to people like you who are putting themselves on the front line to get us through this.
Yeah. Thank you.
Yeah. And thank you for the work you do. This has been really great. I know a lot of people have a lot of questions about what this is like. So this has been, so thank you again.
Yeah. Thank you so much for talking with me.
Yep.